Good afternoon, everyone, and welcome to this afternoon's breakout session on cybersecurity in healthcare. We're aiming for a talk of 20 minutes or so, with approximately 7 to 10 minutes of questions and answers afterwards. What we'd like you to do is to put your questions in the chat box, so we can sort of collate and then ask on your behalf at the end of the talk. All the talks are going to be recorded, so you shouldn't feel like you're going to miss out. They'll be released at a later date. So all the other breakout sessions and the main talks, if you miss past them, should be available later on. At the end of this talk at 3:30 p.m, you will be placed back in the main room to hear the second keynote speech and the closing remarks. Today's talk is going to be with Irfan Hemani, who is the current head of security, strategy and international in the UK government's cybersecurity team. He's also a non-resident fellow at the Belfer Centre at Harvard, and he's a co-author of the recent National Cyber Power Index 2020, which aims to answer the question of who is the most powerful cyber nation in the world. Irfan, over to you.
Thank you, John, and thank you everyone for joining. I really appreciate people kind of signing in and listening to this. I know that it's slightly different to some of the other topics that are happening, but I think this is possibly one of the most important questions that we're going to need to answer, not just as a country, but as a world that is moving towards full use of technology across all sectors, and healthcare is particularly important, not least because it's so personal and so confidential, but because of the opportunities that tech in healthcare offers. So I've got a short presentation. I will try to outline what is important, why is it important, what are the opportunities, and what are the risks, and I'll try to do it quickly and open up for questions, because I think that's where some of the really interesting conversations happen. So the opportunities of technology in healthcare, very briefly, not nearly to the same degree or quality that our keynote speaker did. I'll take us through some of the real world impacts of cybersecurity and technology on healthcare to date, talk through some of the basic frameworks and principles of data security and cybersecurity, and why this is important. So I think it was really outlined in the opening speech, but where there is real opportunities for healthcare and technology is around data. So the keynote speaker talked a lot about personalized medicine, where you can have more targeted outcomes, targeted treatments for better outcomes. What does this mean on the ground? Well, some of this is around patient records, so having that volume and quality of data. There is also, to enable you to design and deliver better treatments. Accessibility of data is really, really interesting more in the developing world, but certainly here where you have patients that will go through a GP's office, a hospital, a care home, and as we heard, even pharmacies that will be able to use your data to provide treatments. There is the highly personalized and quite controversial sometimes idea of genetic data and ubiquitous sharing of genetic data. Talked about often in anonymized terms, but I think as we go through this, we'll realize that there is no such thing as anonymized data when it comes to things like genetics and confidential patient information. All of that leads to better understanding of healthcare issues, generated through significant and substantial data sets, which do lead to better research analysis, but also create some of the risks that we're going to talk about. The other place where this is really useful is around connected devices, and the incoming use of 5G is going to kind of open this up much more, where you have connected devices. So here we're talking not just about remote control fridges and washing machines, but sensors inside people or on people. We're talking about machines and technology in hospitals that send data to a central point. So all of that data can be collated, used, analysed, and put together to have useful outcomes. We're talking about telemedicine, which was something that was much bigger in the developing world, but because of COVID, I think we've all experienced some kind of telemedicine in the last 6 months, whereby you have your appointment with your GP online, or outpatient services or things like that. All of that requires connected devices or connectivity. And then there's something that's slightly less health related, but important nonetheless, when you think that every healthcare service is delivered through an organization, and those organizations use technology, and when if those fail, or if those perform well, can really impact the outcomes of the patient. Thank you. Just before we get on to some of the real world outcomes, I think it's really important to say this isn't about panicking and stopping development. I think everything we do comes with risks. Every time we try something new, there are new risks in the world. It's not about saying we are opposed to these developments. I think it's about saying, what are the risks that these developments pose that we can meaningfully mitigate? So, I think sometimes I do talks where people get quite scared around technology, and that's not the answer here. This is about enabling technology rather than spreading it, spreading the panic around it. So some pretty big healthcare related cybersecurity incidents. In 2017, those of you who work in the NHS might remember WannaCry, where multiple healthcare systems were essentially locked by some ransomware, which stopped people accessing essentially data. I think at that point we were talking about the technology was used for data, reading data, accessing data. And so that essentially crippled the NHS for a short amount of time. Incidentally, it wasn't anything technologically superior. It was exploiting a vulnerability that existed for many years before, which everyone had been told about and everyone was asked to patch, and no one did, which resulted in this. And also, it wasn't targeted at their healthcare system. It was targeted from cyber criminals trying to make money, ended up in the NHS, which was one of the big impact stories. This year, there were very specific malicious attacks on healthcare and vaccine developers, much of which made it into the press. This got quite interesting for something like the COVID vaccine trials, because there was incredible amounts of data kept on Oxford University and AstraZeneca and all the other companies that are developing these vaccines. And all of that was then targeted by nation states who could then use that to their advantage, develop their own vaccines, but also the incredible amount of personal data that was targeted. There's been no reports that any of that's been used, that any of the personal data was accessed, but it does raise the same questions. I know I'm on the vaccine trial, so I kind of saw that and thought, okay, well, they know all of the things that I told my doctor, which were quite personal, as I went into the vaccine trial, which I think is a worry for anyone. And then more recently, in the last couple of weeks, was the first attributed death to a cyber attack. And it was only attributed because, governments and law enforcement have become much more sophisticated in how they deal with these and have been able to directly link the death of a woman to the crippling of a university hospital system as a result of a cyber attack. Again, the cyber attack probably wasn't aimed at loss of life. It was probably aimed at getting a ransom payment. But what it meant was that an emergency patient was diverted from one hospital to another because the initial hospital couldn't deal with the incoming emergency patient, and the patient died on the way. And that was a result of the systems at the hospital not being able to do what they're supposed to do because they are connected and because they weren't secured to the level they might have been if security was taken more seriously. So I'll take you through some of the principles of data security and cybersecurity. Importantly, with data security, you're looking at CIA, confidentiality, integrity, and availability. So I think doctors obviously take patient confidentiality very seriously. There are incredibly personal things that you tell your doctor and your doctor knows about you. If that becomes more publicly available or becomes available to people other than those in the healthcare system, it's at best embarrassing and at worst a tool for manipulation, for ransom, for blackmail. And we've seen recently quite a big rise in the US on the theft of nurse identities, because nurses get quite a lot of discounts in the US. People are actually targeting nurses to steal. I mean, it's slightly different to patient data, but it can tell you what some of the tangential impacts on the healthcare sector are. Integrity is where the personalized medicine piece where we were talking about gets really interesting, because if you can get into systems and manipulate the data, then anyone using that data to do research or determine outcomes is using data which has not been, it does not have that integrity. And the final one is availability, and we touched on that with both the NHS WannaCry attack and the Dusseldorf Hospital one in September. There's also an overlying question of data ethics here, and this came up in the introduction chat as well, of what does it mean for everyone to have our data? How should data be managed? Who should have access to the data? And we can come on to some of that. For the cybersecurity side of things, well, cybersecurity and data go hand in hand. You can't realistically talk about securing confidentiality, integrity, and availability of data without the necessary cybersecurity controls around it. So, so this is how you then make sure you have that those CIA principles. And when you talk about connected devices and you talk about telemedicine, none of that is really risk-free, and it actually can end up being quite high risk without the necessary safeguards. And risk and opportunities we will touch on throughout the talk. So, John, can you move to the next slide, please? So after the CIA, the confidentiality, integrity, and availability, and the data ethics questions, when we're talking about cyber attacks, we really need to look at who is doing what. So all of that data is available somewhere on a system. So your personal healthcare data, other people's personal healthcare data, all of it can be aggregated into different groups or regions or age groups, or, whatever it is. So all of that is available, but again, this only becomes useful or dangerous to a bad actor that has a particular intent. I think that our data is out there is not as worrying as the fact that there are people that want to do things with it, and very specific things. So I'll run through a few of what bad actor intents are. Which was part of our cyber power research, which was published last month. And some of them are more relevant to the UK than others, but I think all of them fall into the question of how we should be looking at this, because I think one of the other things that we forget is when the UK is seen as a world leader in some of these areas. And so when we do something, this is done elsewhere. And if it's done elsewhere without the necessary safeguards and accountability, there are wider problems which we may not face here, but which will lead to bad outcomes in other countries, which would then impact us back. So when we look at a country, for example, like China, or some of the more autocratic countries, that data, which can then be used in aggregate to survey and monitor domestic groups, particularly when those groups have specific ethnic or genetic characteristics. You can then look at what are the genetic traits, what are the health outcomes, what are the health needs of those people, and when you combine that with national policy making, you're basically looking at who has access to what kinds of healthcare. a one that I think we don't look at in individuality. So when we're talking about individual patient data, but which is really important on a national scale, is intelligence gathering and collection of data in other countries for national security. This is the kind of so you will have seen this not in a healthcare setting yet, but when we talk about election interference and disinformation and social engineering for manipulation, we're really talking about very resourceful and competent governments in other countries looking to really kind of look for where there are social divides in a country and manipulate those and exploit those. And that can be done from gathering large sets of data, including health data. The third one that I've highlighted is destroying or disabling an adversary's infrastructure and capabilities. So this is where, if all, I don't know if and when this will happen, but for example, if all life support machines in a hospital were connected and someone was really trying to connect to the internet and, an adversary country was really trying to cause chaos and loss of life in warfare, so this kind of goes over Geneva Conventions and international humanitarian law, would have the ability to switch off some of those devices that keep people alive. And the last one that I've highlighted is really what led to the two that I highlighted on the slide earlier, which was around amassing wealth. So this is where you're trying to carry out a cybercrime, not to try to kill anyone or to sow social division, but to try and get a ransom payment, which then has the unintended outcomes of, like we saw in Düsseldorf, someone dying. I'll touch on the data privacy question. I think it's worth saying that this is largely an unknown for the moment. I think we don't know what the long-term impacts of this will be, but where some of the risks are around harvesting data from vulnerable or unknowing groups. So, if we had a less accountable and more cynical government, they could exploit data of social groups within communities. We may start to see this in, for example, China with the Uyghurs, where you're collecting all of that data and you use that to withhold or change health policy. I think something also to mention in this country is we have incredible safeguards in our country on data privacy and what companies can do. That's not the same everywhere else. So companies having data of people or groups within the UK is perhaps less dangerous than it is in countries where the individual has less control or less a less useful route to challenge some of that. Where this then becomes slightly more concerning is where healthcare is charged for. So obviously NHS is free at the point of service for the user, not necessarily for the government. But in many other countries, and to some extent here, medical insurance drives the market. So when you are able to understand what groups are using what types of different types of health treatments, you can then use price discrimination on some of those for particular groups, which then can be done for economic gain, but often, as we see in healthcare, economics and social outcomes are very strongly linked. The next thing I was going to talk about was, well, where are the risks? So I put this into three different categories. So there's risks to the system, there's risk to the individual, and then there's risks to national security. So the risks to the system are where we have lots of online services and poor security, we will have infrastructure failures. And the mitigation for that risk is not to avoid having lots of online services and connected devices and poor security. It's to understand how we mitigate those risks, improve the cyber resilience of the healthcare sector, rather than avoid technological development. The other risk to the system, which we touched on, was being able to use trends and data for pricing and bad analytics, as it were. To the individual, the risks are around lots of data your data being around, lots of your data being around and used by companies, not necessarily governments, and how that's done. There's the intelligence gathering of specific groups or people, and there's the risk of connected devices. So I think in the keynote speech, they talked about having actual sensors on you or in you. If those sensors, if those connected devices, then, if we evolve to a place where they're doing more than that, dialysis machines or, deployment of medicine through connected devices, there's a safety risk there. And then there's the national security pieces, which we touched on. So that really that brings me to the end of what I wanted to say. I'm very happy to open up to questions. I'm just going to go through the chat and answer some of the questions. So, Rizwan, do you want to? Did you have a question?
I asked a question earlier in the keynote about I think you've kind of touched on it, Irfan, about who owns the data, and there will be a commercial imperative to actually use that data for commercially, and what might be the unintended consequences of all of that, especially as Harari now says that the next kind of level of data gathering will be biotech, which is all the sensors that we're talking about already implanted into us, on us, etc. And all of this is like more personal information than ever before.
So it's a really good point, and it's kind of the crux of what people are worried about. Some of this is around governance, so how we structure our national policy frameworks to deal with this. I guess at its base, there's no harm in a company having data on you from the outset. I mean, we're talking about healthcare, so you talk about a patient in a bed with a doctor. That patient really needs is for the doctor to know what's happening with, different kind of vital signs and other information about the patient to be able to prescribe a treatment. So where it starts to get difficult is where that doctor is making decisions of the patient based on, the wealth of data that's come and been used by companies, and companies have interpreted it and done the analysis and that kind of thing. And that in itself is also not a risk, because really companies want your data to either deliver you with better products and services, or to be able to target you. And so those two principles are not problematic in and of their own until you start getting into the territory of, are they targeting you with products you don't need, which in healthcare could be expensive but also dangerous, but also where the analysis and use of data comes out with treatments based on core AI or data analysis. So the question around AI being used to come out with some of these is an interesting one, because I think AI is only really as good as the frameworks and the systems that are used to develop them to do what they need. And what we've seen with a lot of AI is that they essentially perpetuate existing situations. That's not the case all the time. AI is incredibly useful. It is developing and it's getting much better. But where you have this question of where AI looks at a scenario and says, you get A plus B and it gives you C, that might just be our interpretation of what happens. So data is used to measure and monitor, which are then used to come out with recommendations. Now, if what we're measuring and monitoring is the wrong thing, or we've drawn the wrong causal links, that AI is not useful. So companies having your data is not necessarily a bad thing, unless either the way they're using it gives the wrong answers, or they're using it to sell you things you shouldn't be getting. It then becomes a bit more dangerous when you start looking at, well, a company might be using it for one thing, but what if they are not protecting that data? So you then have cyber criminals using that data to try to approach you or blackmail you. And then what if you have other nation states that use their cyber capability to sow social division? Or where companies are based in that country, they then do things that to influence those companies to come out with the answer that's not right. So it's a slightly convoluted answer, Rizwan, but is that kind of what you were asking?
Yeah, thanks for that, Irfan. That's actually very useful.
Good, yeah. And again, I think it's important, you know, data isn't a risk in itself, it's a real opportunity. There are risks associated with it.
I don't know if you got a chance to answer the question that Zain Kassam had asked in the main session about how do we clear the misconception of the future of personalised medicine with regards to the use of our data?
I think we've touched on it, but again, I think it's a real opportunity. I think it's a real opportunity. So Zain's absolutely right to flag that there is an issue, and actually this could be something that stops us developing and not just in healthcare, but particularly in healthcare, stops us developing better outcomes through fear. I think there's no single answer to this. One of them is making sure you have the governance structure in place. So, for example, in the UK, until the 31st of December, we are part of the GDPR regime, and whatever comes afterwards, it would be nice if it did the same thing, because GDPR did a few things. GDPR put the onus of responsibility of data on companies. So when a company takes your data, it has the responsibility to do a few things, and that in turn gives confidence to people. The other thing is, so there's the kind of governance and policy piece. There's also the, companies now need to show that they are possibly ahead of the game in terms of governance. There is a real reputational point here for companies. They can't just be doing what the law says. They have to actively go out and be better than that. And you'll see that recent Apple adverts, for example, on TV are all about, we will stop people tracking you. And that's Apple saying, we get that there's a concern on this and there are government frameworks. We are much more ahead of that. To the extent that Apple has done that well, I don't know, I haven't looked into it. But even that confidence building by companies is important.
Okay, I've got you've engendered a lot of questions, so we won't get a chance to go through all of them. I think we've got 2 minutes, so I think probably there's Karim Hidji's asked the question about what cyber threats are more prevalent. If you look at the different sectors between finance, health, commercial, corporate, and defence, as well as personal privacy. So I guess what he's asking is which is the more threatening domain.
So I forgot to say at the beginning of this talk, but all of the views in this talk are my personal views and not the views of Her Majesty's government. And I can only talk about what has been put out publicly. But there is a lot that's been put out publicly. Interestingly, during COVID, what we saw was a lot of cyber criminals targeted healthcare systems and healthcare providers. So they moved from different sectors to the healthcare sector, because firstly, it was a point where there was no longer the luxury to wait 2 weeks to try to figure out how to get systems back online. People needed to get online very quickly, so people were paying the ransoms. But also there was an intelligence aspect of that. So, I think the UK published that they suspected particular countries of trying to go for the vaccine. So healthcare is a big one at the moment, which is why this talk was really interesting for me. Other sectors, I think people see cyber criminals as a tech person trying to do something in particular. Actually, these are criminals often that have adapted to the online environment. So people that used to rob banks will now do this online. People that used to go and rob shops will now do this for retailers. So I think the more connected a sector is, the more at risk it is. But that doesn't mean that it shouldn't be trying to connect. I think it means that it should be trying to look at.
We've got about 20 seconds left. I just want to see if we could squeeze in one last question, which is how do individuals try and protect themselves from any threats to their health data?
Every time you get that message saying patch or update, click yes, don't click do it tomorrow. don't use password 123. There's very simple things that probably would have prevented things like WannaCry, and those were some of them.
Okay, great.